The recording already started. All right, we're going to let people roll in. Here, I'm just going to pause it until we're ready to. All right, Dr. Judith Boyce. Boy,
Hello.
we've been waiting for this one for a while. We're so excited to have you on. How are you?
Thank you. I'm great. Thank you very much. Thank you.
Well, this is a special episode because we are going to be launching something that is been in the works for a while. But just to kind of set the stage for folks listening on Health Coach Radio, that, health coaching, generally speaking, the growth, particularly with the, the advancement of the National Board for Health and Wellness Coaching, has become this ever-growing career path within the medical system, the healthcare system. And the problem is there seems to be a little bit of a disconnect, I think, sometimes between the health coaching community and the health care community. Yet there are so many health coaches that want to help, that want to be a part of this process to make the healthcare system better and just work better for everyone. So you are an MD.
Yes.
Also a health coach. So you were uniquely well positioned and qualified, I think, to have this conversation. So we start every interview with you telling your story. So I kind of a little lead up here, but we would love for you to share your origin story on what took you into medicine, what led you to become a coach. Lay it on us.
Okay. Well, it is a long and winding road. So I'll try to make it quick. I was a nurse before I was a doctor. And I was a nurse for 20 years before I did medicine. So I was about 6 or 7 years into nursing, and I became a triathlete. So I got hooked on kind of exercise. And I think actually that most of your health coaches in the audience will get that, because when you start the whole fitness lifestyle of, what you eat and how you rest, and the exercise part becomes really important part of your life. So I nursed for another, number of years, and then didn't want to do that anymore. I wanted to do something in health education, health promotion. So I went back to university and I did a degree in health education. And at that point in time, it was the 80s, and the whole corporate health, which is what I wanted to do. Like now, the economy collapsed and there weren't any jobs. So I loved my program, and I was totally into kind of staying and doing a master's. And one of my advisors says, why don't you, you're so ticked off at doctors, why don't you become one? So, I was ticked off, and I'll stay on that for a minute, because as a nurse, I worked in intensive care units and emergency departments and that kind of thing. It was in sort of intensive care. And I just got fed up with being told what to do by people that I didn't think knew what the patients wanted. Because as nurses, we talk to the patients a lot, and these people were giving orders and walking away, and it was like they have no idea what the patient really wants or needs. So that's why I was ticked off sort of at the medical field, and my family's medical, and and so it was kind of transformative for me at that point in time. So I wanted to do something in health, and that had health at its basis. So I applied to med school, and I got in at the age of, kind of 39. And I thought, wow, they accepted me. Well, I guess I better go. So I did. I went through medicine, and it was 1994 when I started. And in 1996, I got turned on to Dr. Andrew Weil and the folks at the University of Arizona in integrative medicine. So that was it. I wanted to do integrative medicine, and that was my calling, right? So after med school, I did family practice, and then I went down to, I didn't actually go, it was an online course, but I went to Tucson a lot and did an extra fellowship, associate fellowship in integrative medicine. And so that was the way I practiced medicine for 20 years, was in the conventional system, but within my own practice, it was an integrative practice. So patients and I always talked about non-pharmaceutical, non-procedure based ways to go first, unless it was an emergency, unless it was a medical emergency. So that's kind of where I was in my head with it anyway. And then getting to the primal another transformative sort of experience was my own menopause journey and the weight gain and the fatigue and everything that went with that. And I tried every diet in the books and was advising patients, the same thing, because lots of women came to my practice. I found the Primal Blueprint and tried it, and it worked like a charm for me. 15 pounds of belly fat, not overnight, but over a couple of years. I went back to the gym and started lifting, where I had just been running and swimming and biking. Before that, with no success, sort of at the end of all the years of trying, it was just, the weight was just coming on, and not coming off. So I had a great experience with Primal Blueprint. I was totally sold on it and was recommending it to patients. And then I was retiring. Okay, COVID.
Yep.
I turned 65. I was retiring. It all happened in the same year, 2020. And I thought, oh, actually it happened in 2019, because I started the program in 2019. I thought, I'm going to be a health coach. I mean, it was a no-brainer. It just made sense, right? And I'm going to be a primal health coach. So I looked at the program, and the rest is history. I mean, it's just been a fantastic experience.
Wow, that's such a journey. It's such a wild journey, and it's so interesting. And it although it's so unique, it probably in a lot of ways mimics what a lot of us practicing health coaches and primal health coaches have experienced, from the perspective of this conventional path doesn't seem to be working for people.
Right.
And so if nothing changes, I'm going to try something unconventional. That's where we all kind of come in. What I loved about your story, I thought was interesting, was, first of all, you were practicing integrative medicine inside the conventional medicine realm. So were you a complete black sheep? How did that go for you?
Okay. Yeah. So, I was divorced. So, and that's important, because I didn't have a second income in my house to fund me if I wanted to be a complete renegade and start an integrative practice. Now, back in the early 2000s, when I was working in British Columbia, I hope I don't step on anyone's toes when I tell you this, but it's just the truth. The British Columbia Medical Association was coming into our practices and requisitioning our charts and going through them to see if we actually charted that we recommended vitamins to patients. So, you were a renegade if you recommended a multivitamin.
Oh, really?
And so it was, and if I lost my job, I wouldn't have been able to pay my student loans back. So, so it's called, you figure out how to work with what you believe in your heart is the best way to practice, and stay within the guidelines set by your governing body, so you don't get kicked out.
Right. This is important, because we always hear this from doctors that we interview, which is, it's not that doctors don't want to help people. It's that the whole system is broken and kind of cuts doctors off at the knees from being able to suggest, lifestyle intervention and simple dietary changes. They're just not they're not appropriately compensated or rewarded in any way. And it sounds to me like penalized.
It was the opposite. That it's better now. It is better now.
Good.
But I haven't worked in Canada for 12, 14 years now. And I left because it was a little bit better when I left Canada, and I moved to Bermuda and worked there, which also has a governing body that watches what you do. But just the way it was set up, and the way that the insurance was partly paid by employers and partly funded by co-pays by the patients themselves, you had a little bit more latitude.
Gotcha.
And always tried to practice good medicine, but I always practiced health medicine at the same time. So I do believe it's better in Canada now. There are some very brave doctors who've stuck them, especially in COVID, who've stuck their necks out and either been penalized or, penalized or lost their jobs. So yeah, that didn't happen to me, because I always sort of stayed within the rules that were acceptable. Yeah.
Good.
But I do think things are better now.
Okay. Well, that's promising.
Depending on where you are and depending on the practice.
That's what I was going to ask is
Yeah,
because one of the
depending where you are.
questions I'm getting. So, and so for folks listening to the podcast, this is a little bit of a unique podcast. I don't know if I said this since we started, clicked record, but that we got a bit of a studio audience here. We have, as many of you know, Erin and I work for a school, Primal Health Coach Institute, and we've been in the process of developing more courses. You've developed one for us, so we're going to get into that in a minute. But when I'm talking to people about this particular tract, right, in terms of coaching, health coaching in a medical practice, one of the questions that comes up is, but is it very US centric? And can I use a lot of the content that's in this program where I live, whether it's in the UK or Canada or Australia or somewhere else in Europe? And my answer is, even though the medical systems might be set up differently in terms of who oversees it and how care is paid for, resoundingly across the sort of developed worldwide, the problems are the same, right? Yes. So to your point, like, depends on where you are. It might be a little bit easier to kind of, add some naturopathic type stuff in terms of diet and nutrition without any blowback. But generally speaking, the challenges are the same, right? I mean, do you have some thoughts on that, an opinion on that?
Well, yeah, I mean, it's the basis. Okay, so chronic disease numbers or burden, as they call it, across the world is pretty much the same. It's a little bit worse in some countries than in other countries, but the burden of chronic disease in developed countries and also in countries that are low and middle income countries, those people don't have the same quality of healthcare. So the death rates are a little bit higher, are very much the same. The problems are very much the same. We used the US healthcare system because the company is based in the US. And it seemed there had to be, for me, a reference point to go to statistics and to go to what's happening where. So I happen to be Canadian, but I've worked in Canada, I've worked in the States, and I've worked in Bermuda, which is a United Kingdom Commonwealth, British Commonwealth country. So when I was researching for the program, I researched basically US, Canada, UK, Australia, New Zealand. So the major English speaking countries. But then I sort of went back afterwards and looked at the comparisons of the healthcare systems in the Organization for Economic Cooperation and Development. They do statistics on the healthcare systems for their member countries, and their member countries are most of the EU and a couple of South American countries. So there's a really good broad, sort of snippet of healthcare system comparisons there. They've all got the same problems. And then if you go into the World Health Organization website, you'll see that across the globe, you have this problem of heavy burden of chronic disease and healthcare systems being overwhelmed by it. So wherever you are, health coaches on the planet, this course has been designed fairly generically. It says US this and US that when we're citing examples of healthcare systems. So it's kind of up to you where you live to look at your own regulations and your own healthcare system, but the problems are going to be the same. Exactly. And what you learn in this course will be transferable to your country. Maybe with one or two little exceptions of details, but generally you'll have the tools that you need to work in a healthcare system.
Yes. So logistically, there might be some tweaks here or there depending on where you live, but if we zoom out and just look at the problem globally, we can call it pretty universal. So I'm Canadian as well as Judy, and so the statistic in the CDC statistic for metabolic syndrome is like 88% of Americans are metabolically unwell. That probably tracks to Canada. It's not that different.
Canada's going to be very much the same.
It probably tracks. So
and the UK.
So I think what's important there is that wherever you live, this is that the burden of chronic health illness is probably terrible. And also the medical system set up in a way to not support it or turn the clocks back on it. So that we have as sort of our baseline level of understanding. Any specific logistics that are pertinent to your country or region, please understand those. So the course that you built for us is coaching in a medical practice, health coaching in a medical practice,
Mhm.
you are absolutely uniquely qualified to write this course, because everything you just told us, you started as a nurse, were frustrated by the fact that doctors were not connected enough to these patients, but nurses were. So there was a miscommunication there.
Mhm.
Your experience from conventional medicine to integrative medicine, and then deciding health coaching is the thing. You've really been through every arm of the medical system.
Yeah.
So
And came out on top.
came out, and you're
Came
not
out on
even
top.
jaded, and you came out, you're not, well, but what I'm
Okay,
getting
I'm
at
not.
is, yeah. So the course you built for us, that was extremely actionable. It's non-dogmatic, non-judgmental. We're not going to come down on doctors. We're not going to be anti-establishment. That's not,
they need our help. That's right.
Exactly. So we want to help. Okay. So now I know Laura talks every day to people who are trying to exit the healthcare system, like nurses that are like, I got to get out of here. Same as your experience, Judy.
Yes.
So I don't know, maybe my question is for both of you, like, who do you see really, what kind of health coach, what kind of person would be great for tackling this course and tackling this branch of health coaching?
Would you like me to speak to that, or Laura, do you want to?
Yeah, you go ahead and I'll add my 2 cents.
Right, because you did ask me a question a month or so ago about a nurse who was asking you a question. And I'll say this because having been a nurse, and this course is designed for people who need to get indoctrinated into the healthcare system with the language and the standards and the behaviors and the ethics and all of that they may not have in order to go into the healthcare system and fit in and do everything correctly and know what they're doing and have that confidence. Nurses already have that because they've been in the system. So nurses would need to do a health coaching certification and maybe the board certification as well, so that they can bill for their services, right? But this course is for people who really haven't had training in healthcare, because we're giving them the core competencies that they need to work in the healthcare system. Does that make sense? Do you know what I mean?
That is really important. Let's like highlight that, because if you haven't been in the healthcare system, we can't just barrel in there, ranting and raving about the problems with the healthcare system.
Oh no,
that won't.
No, I don't think that's the right attitude to have. You may be, you may have some frustration and some disappointment. Most people do. And the people working in the system as well. It's not just the patients, but one of the reasons that we're going to jump around a little bit here, but there is health reform underway in most of the countries that I looked at, in particular in the US and to some extent Canada and the UK. Yes, and the NHS in the UK. Yes, and they all point to the same thing: patient-centered care, because patients have been dissatisfied with care over the years, and it's gotten worse and worse. Patient outcomes have gotten worse and worse. So they want to improve patient health outcomes, they want to improve population health, and they want to reduce costs. And health coaching has been proven in scientific studies to improve all of the aims of healthcare reforms. So health coaches are being invited into the healthcare system now in droves. They're trying to find places for them and hiring. There are jobs in hospitals, there are jobs in managed care organizations in the States, there are jobs on apps. You can, get a job with a health coaching or healthcare app where you support people on the app. You don't even have to leave your house. There's a huge one in the UK that's headquartered in Berlin and also has a headquarters in Copenhagen. So all of those countries. So it's all coming. It just depends now on where you as individual health coaches want to work, where you feel that you want to work, what patients you want to coach. And I think that's really important, because you're going to have opportunities everywhere, and it'll be the qualifications you need will be a little bit different. Right. So if you're going to work at home in your entrepreneurial health coaching independent practice and request to get referrals from physicians, you're going to have to do a bit of marketing there, and you may not need a certification. But I think you'll have to record your sessions in the electronic medical record and things like that. So you may need a certification to do that. But if you're going into a hospital and you're going to work face to face with patients and work on a team with other healthcare providers and with doctors, you'll need some sort of certification to get hired.
Absolutely. Yeah. And this is what I keep talking to people that are interested in going into this realm, and they're asking about jobs and where the employment opportunities are. I highly recommend they take our path to get you board certified. It will open up so many more opportunities. You don't have to have it. You will find employers, particularly smaller practices, that really want that aren't going to have that concern. But large hospitals, insurance companies, the VA, they're going to want that national board certification if you are not already a nurse or an RD. Right. And sometimes they want both, right? So some of the positions, I'm like, ooh, that one's paying 125 grand a year. What do you need for that one? They want you to be national board certified and a nurse, or national board certified and a therapist, or something like that. But what I will tell you is I do think we're going to continue to see these incomes grow as the efficacy of a great coach working with people continues to improve outcomes, right?
Outcomes and costs, as their costs go down, the value of their health coaches is going to go up.
And so I think the benefit of this additional course is exactly what you said, Judith, on two tracks. So first of all, for those that have never really come up in the healthcare system, it truly is a different language. Yeah. When I, as a health coach, come in and I try to talk in health coach language, a lot of this does not track with the terminology and the language that's often used with medical professionals. But also, if I were, thinking in terms of a nurse coming up in this healthcare system, trying to change gears from being a nurse to being a health coach, it's a different role. And so a lot of what we're going to be addressing in here too is how to do that, right? In court, not just switch goals, but actually build a program and implement a program within a medical practice. Yeah. So I think this will be beneficial for folks regardless of your background. But I don't want people who've never stepped foot in a medical institution or never worked in that space to be afraid of reaching out, because we need so much more. To your point, things are changing, to quote, I think it's Wayne Gretzky, you got to go where the puck is heading, not where the puck is now. Where's the puck heading? And that's where I personally think that the rate of growth, so we will always continue to see health coaching grow broadly, regardless of the direction you want to go. But I think the rate of growth is going to grow faster in corporate wellness and medicine. Those two places. So let's go where the puck is going.
It's happening.
I've got a couple of questions here. So,
okay, I'm just going to make something clear, because I do see a question about CPT coding. Right now, health coaching has a CPT category 3 code, which means that it's under, they're watching it. It's an experimental or an emerging technology. That's the category. So it's being assessed right now and monitored for its value and effectiveness or efficacy. So it may be 2 years. That started in 2020, by the way. So it's usually about 5 years before they grant it category 1. So anybody that's here that's in the medical, somebody here looks like they really know about medical terminology and medical billing. It may be quicker that they grant it category 1, because once you get category 1, you can bill for your services and be paid by insurance companies. I did read that there are some insurance companies, it depends on the company, will actually reimburse people who do have a CPT category 3. So it is possible that some patients will be able to get the health coach will be able to be reimbursed. So it's always worth asking or submitting an invoice. But right now we're still at CPT code category 3.
Yeah.
So not reimbursable. And the other piece of that that's attached to that is the healthcare system is obsessed with certifications and licensure. So all of the other healthcare professionals that you'll be working with inside the 4 walls of the institutions and the hospitals will be licensed one way or another. And the licensure that they've deemed acceptable for health coaches is the board certification. So the board certification and the ability to bill insurance go hand in hand. You have to have that certification. Now, nurses and say physios and other healthcare, occupational therapists, whatever, if they decide to become health coaches as well, it's up to their individual institution to create the definition of their job
Yeah.
and
Right.
decide whether or not they need that extra health coaching board certification on top of their nursing or their
Okay.
licensure in the other. But what I see, and I'm sorry to go on and on about this, but
No,
it's
this
just
is good.
it's a huge thing.
Mhm.
What I see from the studies that doctors have done in the States and also in the National Health Service in the UK is that they're so excited by health coaching and the idea of how it's going to help people. If someone's a nurse or a physician or otherwise a healthcare professional, they send them on a
Yep.
weekend course and they teach them a few health coaching
Yeah.
approaches, questions to ask, and active listening. But they have literally a weekend course,
Interesting.
and then they send them back. Then they send them to be health coaches.
This is interesting because, okay, so this is awesome. Thank you for clarifying that. So what we know is that the CPT code it's not an active reimbursable one yet. It's currently they're just keeping an eye on health coaching. So they're these codes are being plugged in from the perspective of tracking the data to
Being
see
plugged in is important. Yep.
Right.
So they can follow it. Yep.
Great. But what you're saying is that if and when it gets upgraded to this category 1, the CPT code has to coexist with some kind of license or certification that is recognized. So that would be the NBHWC credential.
Yes,
for
that's
health
what it is.
coaches.
Yeah.
Yeah.
And then
Okay.
there's another body called it's a health education body council. It's a health
Okay.
health education is in there. It's 2 bodies that they'll accept certification.
Yeah.
Or
But if you're already licensed, if you're a nurse practitioner, nurse, doctor, you already have the licensure that's needed. You could take a weekend health coaching course and that would satisfy that.
and then you're a health coach as far as they're
For better.
concerned. Right now, that's yes.
Okay.
Yeah.
Gotcha.
Yeah.
That's good clarification.
We're gonna screw it up because here's my observation. So I've told this story before. When I found myself knocked up with twins in my 40s, I'm clearly a high risk patient to United Healthcare, which was my insurance carrier at the time.
Mhm.
I was over 40 and I'm having multiples. And I was assigned essentially a health coach to basically call me every month to just see how I was doing. Do I feel safe? Am I doing blah, 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 blah. So health insurance companies have realized the benefit of having somebody kind of tracking with each patient and are they compliant? Are they doing this? But they're calling it health coaching. I'm like, that is not health coaching. That's not health coaching. They're trying to apply the same public health, like from the top down approach for a situation and problems that are very individualized.
Yeah.
So the whole like weekend course thing is, they're going to figure it out. I'm sure they are. And,
yeah.
and the fact that I do agree, I think we may see that CPT code upgraded to 1 a little sooner than 5 years because the CDC has bought into it. They have issued a grant to the national board for a group health coaching program for type 2 diabetes and insulin resistance. So I think we're going to see this come to fruition. Guys, let's be where the puck is going. Oh my gosh, we got to learn to speak the language.
Yeah.
So I want to start. There's a couple of questions that have come in, and this one's a really good one from Michelle. Where is it? Let me find it. She was asking, they, meaning doctors, need our help. So this was from earlier. Can you please expand on that? And also, would it be billable, which we've already answered that, I think, in terms of billability is coming. There may be people, I think, depending on their insurance carrier, might be able to do like flexible spending or something if the carrier allows.
Always, I think the patient needs to check with their insurance company.
Yeah. But in terms of what do you mean by doctors need our help? I mean,
me. Yes. Okay. So I lost the train there of the question that you were asking, but that's the question you're asking. Well, physicians are completely overwhelmed.
Yes.
Completely overwhelmed. And I think it's fair to say, and I did it for 20 years and I know what my friends were saying, and it didn't matter whether they were integrative medicine, trying to spend more time with patients. Like I tried to spend more time with people and, it's very frustrating, but every doctor wants to be able to spend more time with patients and they just can't. They're just driven by this. You've got to see a certain number of patients per day. You have to bill a certain amount. And, you're just, the minute the patient walks in the door, you're thinking, what's the quickest way to get this person out so I can get the next person in? And some doctors are a little bit more, I don't know what the word is, like just driven to do that than others. So those of us that like to spend more time with people and really get to the root of the problem instead of just writing a prescription or sending them for blood test, it's equally as frustrating as the doctors who are really trying to push through lots and lots of people.
Right.
So doctors need help because patients aren't happy with the care they're getting. And they're giving that feedback to the people, the quality improvement departments that are in almost every practice now, because quality improvement means you monitor the practice and you monitor the financials, but you also monitor patient outcomes, and you monitor whether they're happy or not. And they're bad. The reports aren't good. People aren't happy, the outcomes aren't good, and it's costing too much. So doctors can't do that work on their own, and they aren't trained in lifestyle medicine unless they go back and get extra training like I did afterwards. And I was into it myself, but they're not trained in medical school, so they don't know how to do it. And chronic diseases are lifestyle diseases, the diseases of poor lifestyle. Right. So that's the bottom line right there. Doctors need the help. Patients need the help because they're not happy and they're not getting somebody that's there to support them, and on the other end of a phone if they need help. And the practices need health coaches because they help to reduce costs.
Sometimes I think having a nihilistic point of view is helpful.
Okay.
What I mean by this is, it's like, look, we're probably not going to change the fact that a doctor has 10 to 15 minutes with you. We're probably not going to overhaul that anytime soon.
But you don't have to if you have a health coach, because they take over.
Exactly.
So the good news is that's okay. We got you, doctors. So, there's one part in the course that you share, and I really enjoyed this. You walk through, the patient walks in the door, they approach the desk, they give their name to the receptionist, that now you're plugged into the system. The nurse comes and grabs you, gets your vitals. The doctor gets pinged that you're here. You have 10 minutes because he's got the next, like you walked through what's happening like behind the scenes, this little hive of activity that I don't think the patient is even really privy to. And I was never privy to because I've never been sick, really. I've never really had to get into the healthcare system, thank goodness. Yeah, but it was just like, wow, what like literal hive of activity. And this patient ends up kind of simply being codes that are then punched into the forms and you're off, right? Really, really not a client-centered, patient-centered approach at all. And so that's where patients are probably feeling very sort of
like a number,
like cattle, right? But again, the healthcare system is probably not going to change. It's probably not going to change anytime soon where the doctor has more than 15 minutes, but that's where we come in. And I think that's a really good pitch point, because doctors need our help. They're frustrated by this experience just as much as patients are. So it feels like that's a leverage point for any health coach coming into a practice to pitch. But one thing you talked about that I loved is you said, before you go into a medical practice, you have to speak their language. You have to understand how they chart, how you can't just go in rogue. You have to fall in line with the system. So we're going to teach people how to do that. And I know I'm kind of jumping the gun here, but this is actually curriculum in the course as well, but just quick hits from the perspective of a health coach who wants to do this. What competencies should they have, or how should they pitch themselves? What are some of the quick hits? Like, if you want to do this, here's how to get yourself your foot in the door of a clinic.
Okay. So those are two different sort of things a little bit. So the core competencies, I can run through them right now and list them. So you have sort of your arms around that. I firmly believe that a health coach needs to decide what the best scenario for him or herself, I can use him and her or themselves, is. Like, what do you want to do? Do you have a life experience in your family or with yourself with a particular disease that you're very interested in, that you have knowledge of? Do you speak a couple of different languages? Or you're from a particular culture where there's lots of people that are similar to you in your community? Because we know that's very helpful. If a health coach is as similar to a patient as possible, everybody gets along better and the patients do better. So is there a niche that you fit into that you want to work in? And then go there and see if when you present yourself and you talk about your qualifications and what you want to do, if it doesn't just hit home with them, right? That's one thing. The other thing is that these core competencies that we have are pretty dry. It's pretty dry stuff, but it is stuff that you have to sort of know to work and fit in the healthcare system. So you're all speaking the same language around the table, and that, probably so that you'll get a job. So, so the first core competence, these 9 core competencies were deemed by the Institute of Medicine to be the core competencies that health professionals need to work in the healthcare system. Okay, so if you look at other medical bodies and government bodies, you'll see other competencies, but they'll be basically the same as this. There may be fewer or more, but this encompasses all of them. Okay, awesome. So the first one in the United States is a basic understanding of the US healthcare system, which is a juggernaut. But the reason to understand it is to understand what has not been working and where the new models of care and the new healthcare trends and reforms are going. And then where does health coaching fit into that? And I explained to you that it fits in because health coaching has been shown to help the triple aim of the healthcare reform in the 3 aims that we talked about. Patient-centered care and effective patient-centered communication is the second. Patient-centered care is basically global now. They want patients to take more interest and engagement in their own care, instead of the doctors just telling them what to do and the patient goes home and doesn't do any of the things that's been prescribed or been recommended. The patients are now part of the team, and they're helping to make decisions about their own health care. So the health coach needs to be on the team to educate the patients, to support them in self-management, because the healthcare system can't manage people. It's too much, and to be there to help support them in their goals, setting their goals for health. And and in some cases, when you work for the healthcare system, when you work for an institution, you're actually helping to navigate and guide the patients through the system.
Yes, advocating, helping.
Yes.
You touched on this a second ago, which I think is really cool. So we're talking about the healthcare reform, and one of the objectives is let's put some of this these behaviors of self-management into the patient's hands. So make sure the patient goes home knowing what they need to do and how to do it. And so the outcome, and so now I'm going to zoom out, the outcome of a health coaching conversation, whether you're in the healthcare system or not, what I teach this in our master coach course, we teach this in the main certification course. The outcome of every health coaching course is that we deliver the client to self-efficacy. The belief that they know what to do, they have the resources and or can track down the resources and the support to do it themselves. This autonomy, self-efficacy, that is the outcome of every health coaching relationship, period. And so that specifically speaks to what you said, which is the health coach needs to be on the team to support the patient in their self-management. Now we have an empowered patient who can proceed and extract themselves from the cycle of this healthcare system. That's and health coaches, we double down.
That sentence that you just said, my program has prepared me to graduate people from my health coaching programs with them.
Exactly. As
self-efficacious or engaged, activated patients.
Right.
They'll love it. They'll even because this triple aim is all, is perpetrated all through the whole healthcare system. So that language they understand, and they'll understand that.
Right. So if you're pitching yourself, we're using the word pitch. I don't know if it's the right word, but let's just go.
Market or whatever. It's still kind of commerce-y sounding. Yeah.
It kind of is. Yeah. But that would be a message to double down on. And in fact, if we even pull the curtain back more, it's like, as a health coach, do you feel confident that you have an approach that will deliver a client to self-efficacy? Because that's actually what the healthcare system wants and needs from you.
Yes. Well, it's funny you should say that. I'm just going to run through these competencies because each chapter of our course is built around 1 or 2 or 3 of the competencies, right? And what you just said about program planning is our chapter 4. Evidence-based, I'm going to jump to something else now that the medical system is nuts about, is, for good reason, is evidence-based. Everything evidence-based practices that your coaching practices have to have some evidence behind them. Your program has to be sort of evidence-based. Does it work? Has it been proven? So your evidence-based programming that you go into market to whoever you're going to work with, or you hope to work with, has to have sort of that evidence-based stamp on it.
Mhm.
So in our chapter 4, we've sort of built a template that automatically is an evidence-based template with health confidence as the outcome, and health confidence is health efficacy. Patient has self-management skills, has been educated. So there's a little definition of health confidence. Their health literacy, it means that the patient is interested, activated, and understands how to get the information they need to help themselves. So that is our main goal. And it's a generic health coaching program where the patient's goals then get slotted in as short-term goals. So the patient has their own goals, the physician has their goals for the patient's disease management, but they all go into the goals that the patient sets to work with you weekly or every second week. So that's the patient outcome, but it all works towards greater health confidence, and greater health confidence has been shown to hit all those triple, and it gives me chills, right?
Yeah.
Because greater health confidence in patients, better patient outcomes, better population health outcomes, happier patients, and lower costs. So that's the program. So if you have a program, then that's the template that we provide in our course. You can slot in your own methods and your own goals with your patients, but health confidence is the outcome. So if you go into a practice and say, I can graduate, your patients will have greater health confidence.
Wow.
And it's in the UK. Health confidence is a thing in the UK. It's in the US and in Canada. So people understand this.
Yeah.
So when I discovered it, I was like, okay, this is going to be our outcome goal for our template program, right? And so
sounds amazing.
Yeah,
I mean, it just sounds amazing.
I got excited and lost my train of thought. But it was the programming. When you said about the programming and the marketing, I think that this particular course that we've got here will give our health coaches that take the course those kinds of tools to take into practices.
So this is a great segue into a question that came in from Tracy. So Tracy is emergency medical physician assistant, and she also did Andy Weil's program as a functional medicine certified as a PA. Also a primal health coach, but she hasn't started practicing.
Yeah.
She says, what I'd like to be is a health coach with a functional medicine provider.
Right.
But do not know how to start. And what exactly does a health coach in a functional medicine practice do? So I think that what you just said was kind of like this broad message that the outcome goal for a health coach, certainly within any medical practice, but certainly within the functional medicine practice too, is this idea of health confidence and self-efficacy and empowerment at the end of that program.
Right.
So can you provide maybe some, I guess, a little more detail there in kind of how something like this might flow within a medical practice, understanding the health coach's role and where this could possibly take shape?
So to Tracy's question, it's there are models of medical practices within the healthcare system, and the physicians and functional medicine docs, integrative medicine docs are a little bit different in that, like I did, I was still conventional. I've taken some training in functional medicine as well, love it. But a lot of functional medicine docs can be chiropractors, they can be osteopaths, they can be, I think, physicians. I'm not sure if there's another sort of, I think in the States, those are the ones that can call themselves doctor. I think there's some nutritionists who actually who do functional medicine, have clinics. But my point is that they're private pay. Okay, so they're not necessarily covered by insurance, although there may be some insurance coverage for some of the things that they do. These are generally private clinics. The patients then who come to these clinics may tend to be a little bit more already self-confident and health confident, because they're motivated to seek out functional medicine as opposed to the conventional.
Yeah, that's a good point.
Yeah. So these people that are in functional medicine clinics may have more money to spend. So it may not matter if you're board certified to work in that clinic because you won't be billing insurance anyway. Right. although it depends on who owns the clinic, whether or not they want you to be certified. It depends on the physician's own approach, because they'll have education in lifestyle medicine. So they'll have their own approach to what diet they prefer, what programs they want to do. And so you may actually end up sort of delivering their programs, because a lot of health coaches now we've spoken to for developing this course, we're working already in functional medicine or with physicians who are sort of out of the Medicare system, definitely, and out of insurance altogether, and just billing patients and spending more time with them, and just billing patients as they go. So in that case, you may actually not be billing insurance. You'd either be getting paid by the practice, or you'd be taking the patients on referral and billing them yourself.
Yeah.
Yeah, so that's what it might look like. And these tend to be, and I'll just wrap up by saying that these tend to be health coach friendly practices, and it might be a good place to start.
Yeah.
We talked about that, didn't we?
Yeah. Yeah, that's good. That's helpful. That's actually really helpful distinction between what it'd be like in a functional medicine clinic versus a conventional healthcare system sort of scenario. Really good points. A client who's opting into this concierge service is maybe more literate or confident in their health, and they have the resources, so it is different. I think we've talked to a lot of folks who run functional medicine, integrative medicine clinics on the podcast, and we've seen it happen both ways, where we've seen it happen where the doctor is the first point of contact with the patient and says, okay, this is our our outcome goal for you. I'm going to have the health coach work on this bit with you. I'm going to get you set up with them. We've also seen it the other way around, where the health coach is the first point of contact.
Oh, right. Yeah.
Yeah. And the patient comes in with, or the client comes in with, their big health goals, their vision of their health. And the health coach says, okay, I'm going to work on this with you, and we're going to get you set up with the doctor for all this stuff. So either way, but it's a pretty cool setup. Functional medicine clinic would be that deal. But you also made a good point, which is if you go into a functional medicine clinic, they may or may not be a primally aligned practice. So just know that.
Yeah. So to Tracy's question, I think that she should sort of so Tracy, you're listening. I think a good idea for you would be just to find clinics that are in your area, or that maybe online. There's a job online you could get.
Yeah.
And if it jives with the way that you practice and you're a good match with the clinic, I'm sure you could get a job. I would be willing to stick my neck out and say that I think most functional medicine and integrative medicine clinics that are private in the US and maybe in Canada, but maybe not yet, are hiring or have already got health coaches on staff.
Yeah.
So it shouldn't be a problem.
Noah's pivoting to more of the conventional, traditional. He's asking, do you feel like health coaches operating in the traditional medical system have a different set of challenges than those operating independently? Are they more restricted in their ability to make a difference? So I'd love your take on this. I have my 2 cents on that. I'm sure Erin does too, but what's your initial?
Yeah. So I would hope not. Because everything is relative in the way that you make a difference. So if you're working with patients who we haven't even touched on social, like I sort of went halfway through the competencies here, and cultural competence and socioeconomic, understanding of socioeconomic, social determinants of health, and how people who are being looked after by like government insurance, like Medicare, Medicaid, NHS, who don't have great resources, who may have mental health issues, and who are also sick. Yes, you would be restricted. When you go to work in a hospital, you're restricted by all kinds of regulations.
Yeah.
And you'll have somebody looking over your shoulder and breathing down your neck the whole time. So you may not be able to recommend a primal diet, for example. That's another whole section of the course that we said, look, here's how you work within regulations. If you're going to do evidence-based lifestyle recommendations, they would have to be sort of CDC, US diet regulations, and you'll look at them and you go, oh my God, but they're very general. I've looked at them, and you can work within them and make it work based on how your patient, what your patient wants. It's about patient-centered care. How does your patient want to eat? What is your patient comfortable eating? And then you're going to coach the patient about the healthy way to do that. Okay. And if you can really make somebody feel better, if you make your patients feel better because your recommendations are helping them just navigate whatever challenges they have, that's huge.
Yeah.
You know, even if you've got some, excuse me, idiot breathing down your neck and telling you this rule and that rule, and this, because hospitals are run on rules.
Yeah.
So yes, you'll be restricted a bit, but you'll be able to make such a huge difference.
Exactly. I like that message. And, I teach that in our master coach course because our master coach course is the course that satisfies this NBHWC educational requirement. So anybody who is looking to become a board certified health coach for all these reasons we've mentioned here, that would be the educational track you'd need to take. And you have to take both. I'm obligated to teach the CDC oriented approach to diet, nutrition, lifestyle, cholesterol, all of that stuff. We are obligated to teach it because this is a national board qualified course. And I always tell my students in that course, we need to know this. We need to know what our clients have been taught their whole lives and what the hospitals are going to double down on. We need to know that.
Yeah.
With no judgment and with dialing back the dogma of what we believe, literally meet the client where they are, which is they believe that the food pyramid's good and what have you. For example, an example that comes to mind is that, in the primal approach, one of the first things we would ask people to do is eliminate grains.
Yeah.
A lot of people aren't ready to do that. In my private practice, a lot of clients aren't ready to do that. So we don't. Nobody's yoinked away my primal card yet because I'm not making my clients give up grains. They're not ready for that yet. There's 100 other things, other dials we can turn that are going to make massive impact to these people. And that's the client-centered approach.
Yeah, it's true. It's the client-centered approach. You got to meet them where they are. And that's what the healthcare system hasn't done for people. And patients really, really appreciate it and they react really well to it. So the message is you can make a difference. You can make such a difference for people. So just know that.
The larger the system, the more constrained you're going to feel, I would imagine, right? So it may be a little bit easier to get your foot in the door with a small private practice, although those seem to be disappearing by the day, right? They're all getting bought up. However, they all still have the same problem. A lot of these larger, what were once small practices that are now larger conglomerates, they're still trying to get costs down. So it's an approach to go in there and sort of working within that practice to kind of help improve the overall efficacy and cost and client outcomes. I think that message is exactly the same.
Yeah.
But here's the thing, especially for people that live in tougher states, like I used to live in Illinois, I wasn't giving quote unquote diet advice anyway. I was having a conversation and if you just sort of lead with a nutrient-dense whole food diet comprised of local foods that are in season, I don't know any medical professional that would be like, that sounds crazy, Yeah. And to Erin's point, for some people, if that still means whole grain pasta, whatever, however they design that and what they're ready for, it's a better starting plate than Wendy's, right? Or down here in Florida, Chick-fil-A, whatever it is. So it's starting kind of where your client is now, but the larger the institution you try to crack, the more sort of constrained you're going to be in your approach. So in some respects, it might help to kind of start and get your feet wet with a smaller practice if you can find one. I remember when I made this shift professionally, my regular MD, normal conventional medical doctor, when he was like, God, I haven't seen you in years. I used to see you like all the time. I haven't seen you in a long time. What's going on? We had 15 minutes and I really wasn't sick. I just needed blood work. So we had a chat, and I was telling him about this switch I made. And he said, so wait a minute. So if you actually give someone like a framework and provide advice and recommendations, what have you, they'll actually do it. Like he was dumbfounded by that. And what I said was, look, by the time someone's ready to come work with me and pay out of pocket.
Exactly.
They're willing to kind of do things on their own here. And he's like, wow. Give me your card because I've got people I can refer.
There you go. You just pitched.
Exactly. By the time they're willing to come pay money out of pocket to see me, yes, they're going to do the work they need to do. And it's not necessarily my rules, to Erin's point, right? And look, in the beginning, did I start that way as a new coach? Hell yeah, I did. I started out kind of like, you need to do this and here's all this education. Now that you have all this amazing information, let's do it. And then dumbfounded why my clients couldn't do these 8 things that were horrifically complicated for them, totally upended their lives, even though they had all the right information. So rewind, I learned quickly that doesn't work, and really had to lean into just the coaching chops, and dealing with just what's the one step that you're capable of doing today. But I will tell you, even in traditional medical practices, if it's not that they are set up to actually bring you on as an employee, there's a willingness there to refer for clients that are willing to just pay out of pocket. We've seen that.
Let me just tell you, I read, if I can just interrupt for 2 seconds, I read something just recently. Well, in the last couple of days, I was finishing up one of the chapters. Studies have shown that patients who are referred for health coaching do better with their results of their patient engagement and confidence than patients who aren't. So there's a thing about paying, and there's a thing about being referred by your doctor. But on the other hand, you'll get some patients who've been in the sick role, and the sick role is they're older and sicker, and they've always been looked after by their doctor, and they've always been told what to do by their doctor, and they have no confidence whatsoever to make decisions for themselves. And they may be a bit of more of a challenge, and they may or may not be. Well, I'm sure everybody's coachable, but they may be a little more difficult to get to take responsibility for their health because they never have. You will get those if you work in the system.
You will. That's a stage of change thing, right? That was my mom, who was very, very trusting of her doctor, even though the doctor was giving her the medical systems are giving her no relief of her symptoms, and honestly co-prescribing opioids that should have never been prescribed. But
you'll get those.
Yeah. But I just had this is an anecdote, but I've been ranting and raving about the drug Ozempic on my Instagram stories lately. Not to get into the weeds of Ozempic, but because it's being used by rich people, by celebrities and influencers.
There's another one now they're injecting, a newer one.
Oh, is it? Okay.
So this is a diabetes used. Right.
It's a diabetes drug. It's a diabetes drug, but if you're rich enough and you have access to it,
side effect is weight loss.
You lose weight. And so in a manner of speaking, Ozempic is kind of masking or kind of solving for the symptoms of insulin resistance, which is what I help my clients with. So it's like, and I was talking about it, when I was insulin resistant, I would have killed for a pill, it would have been great to have something, but I didn't. So I did it myself. And I got so much grief in my comments from health coaches who couldn't believe that I wasn't more pissed off. And I said, look, the people who are going to take Ozempic are going to take Ozempic. They're not going to work with me. They're not in that stage of change. And so that's sort of what I think what you're referring to is that there's some people in the medical system who are in the medical system, and they're probably not going to be our audience, but more and more and more, I believe health consumers are becoming more empowered or curious, like maybe there's another way out of here. And so that's the opportunities are growing for health coaches.
This kind of let me just, because I want to touch on, so Todd had made a comment here about this sense of superiority in the medical system, but it also comes across in health coaching, right? That we're somehow judgmental of people that aren't making these right choices and what have you. And he's saying, I really want to start with the patient and be where they are. And you're absolutely right, Todd. And he says, I also want to start where the doctors are. How can I help both? I don't want to preach or educate to either. I just thought that was such a great comment, because you're right. Awesome. There is a lot of superiority in terms of just do it yourself. And, here's all the information you need. I'm going to give you this diet or this strategy, and you're not compliant with the health coach somehow. Like, no, that's not what health coaching is about. Right. Yeah. So I would love your kind of 2 cents on his questions here is how can he help?
So Todd, a great way to start where the doctors are is offer them a free coaching session or a free develop a doctor package. They need it. They need it so badly. Some doctors are runners or they do this or that, but none of them have time. There's so many overweight, sick doctors out there, smokers, and they're just, if you go in there with, hey, listen, this is what I do. Would you like my a snippet, like a 6-week program, just give them a freebie. Demonstrate what it's like, so they'll know what it's all about. So that's one of the suggestions we make in marketing. That'd be a great idea. You're going to get doctors who are just on their high horse, who are, just tunnel vision, and it may not be the right practice for you. I mean, you'll go in there and they may talk down to you or whatever. As a nurse, I can tell you, it's just, they learn it in medical school. So you may just find, you know what, I don't want to work in this environment. But, you know, you may actually be able to turn somebody around, have a really good experience. So
Yes.
I'm going to quickly, for 2 seconds, just finish these competencies because it'll help you understand that there are different niches. There's so many different niches for health coaches. You can seriously, basically write your own ticket right now, decide what it is you want to do. When you go through this course, you get all the options and you'll have an idea of what's out there, or just do your own online searches or whatever to find out in your community what's out there and decide where it is you'd like to work. So I got to chronic disease and the social determinants of health is core competency number 3 after patient-centered care and communication. Cultural competence is 4. It's a little bit separate from the from racial or poverty groups, lower economic groups. Cultural competence is understanding and being open to being curious about somebody's differing background, their beliefs. They may have different belief systems around medical care, what it means to be sick, how to talk to doctors. So it's a lot of openness and you know, active listening and a lot of questioning and not jumping to conclusions about people. Ethics and professionalism. So you have to learn medical ethics. So tried really hard to make that as brief and understandable as possible. Very dry subject. And then acting professionally with your colleagues and with your patients. So there are some rules and regulations you need to know there. Working on teams. So working in interdisciplinary teams is part of healthcare reform. So you're going to have teams of, like a patient will have a care team. Right. It'll have a physician, it will have probably have a nurse manager or somebody who's the team, runs the team. And then there'll be whatever other nutritionist, whoever else needs to be on the team for that particular patient and the health coach. Okay. And it might just be you and the doctor. So if you're in a smaller practice, it might just be a teamlet. So it'll be you and the physician and the receptionist who makes the calls and calls the patient in and, you know, sends the requisitions off and does that sort of thing. Or it could be a larger team. Coordinated care is a very specific type of care for patients who have 2 or 3 or 4 chronic diseases and are mentally ill and have no resources and are very complicated. Okay, a very complex patient. Now, those teams exist in institutions and probably want a special coordinated care provider certification, which is going to be a bit more than what we provide here. I mean, there are colleges that have, I think it's called CCP, chronic care provider. So it's a health coach, but they've got this extra training to be on these coordinated care teams. You might get hired to be on one, but they want a really good knowledge of chronic disease like diabetes and heart disease. Community orientation means that once you discharge a patient from care, you can help them get the support in the community that they need, or the services in the community to keep them, support them outside the 4 walls of the system. The importance of quality improvement, so you understand that everything gets monitored for efficacy and cost in the system, even in small practices. And then information technology, documentation, and confidentiality. So you have to know, sort of be open to learning the technology. You're going to communicate with the patient via a portal. How to document. So we go into a fair bit of detail about how you write your notes. And patient confidentiality, which is protected by law, which is really, really, really important. What to divulge to whom and when, right?
That's great.
Yeah. So those are the competencies that have been deemed important. And our chapters go through each competency and we built the chapters around them. And we tried to give you a really good idea about sort of, in the competencies are chapters 1 to 5, and then chapter 6 is just a compilation of resources and practical advice and insider tips that I can remember that from nursing and physician standpoint that'll help you sort of get in there, break the ice, and scripts, what to say when you call up, cold call, what to say to doctors, how to talk to doctors, how to be, you know, in a sort of a healthcare team. What to wear, you know, just kidding, but I mean, not. And we try to give you as much information as possible so you're equipped to go in there and fit right in.
Yes. So I think this is really important summary is that the course was built with these competencies in mind. So the course was built from the perspective of the healthcare system. Essential. We can't, again, we can't go in there like a bull in a china shop and, start throwing things around. We have to go in understanding what the healthcare system is expecting. And then that final chapter is, this is sort of the implementation. Now that you know all that, here's how you can execute it.
It's a roadmap to get a job, a roadmap to get out there and find a job, the job that suits you, and then the toolkit for all these little extras that you have to fall back on, to put in your briefcase.
Yeah. And just like a little sort of behind the scenes, like when we were in the early stages of preparing or, conceiving this course, you pulled up this list of competencies and said, I think this is important. Do you think this is important? And we said, yes, that's what we're building this course on.
So we found this, and it was in another course that came out of New York, actually, that prepared any worker to go into the healthcare system. I said, well, we have to prepare our workers to go into the healthcare system. I did it. I mean, I had to do it twice, in nursing and in medicine, go through all these competencies. And I was like, wow, our people need these.
Yep.
Yeah. So here they are.
Yeah. And understanding what, a medical professional or an entire practice, these core competencies that they're tasked with, and trying to figure out how to juggle all this, you've got to be able to use your term, fit right in, and demonstrate that you understand kind of your role within this entire framework. And I think you've done a great job of this. And in chapter 6, putting it all together, a vision, a roadmap, a toolkit. I mean, it's important that you understand all of the core competencies, but how does it all work together, and sort of where do you fit in this paradigm? And the biggest thing I think you need going in is confidence that you can make a difference.
Yeah.
Right. And for those of you, I mean, I know there are some people that are still very, everything's rigged to big pharma or insurance.
But that's all true.
Yeah, we get all that. Okay. So the question is, do some of you want to be able to improve the outcomes with the individual patient in the medical system? If that's what lights you up, this is a great course for you. Yeah. If you want to work completely independently and outside of that system entirely, we're seeing doctors and nurses do that, and hiring health coaches as well, or you just want to work independently. But I do think there's a lot of benefit in having a healthy respect for each other and what we do, and the challenges we all face on both sides of the aisle, right? This comes up a lot about wanting to bill insurance as a health coach, and that sitting for the national board could then eventually mean that I can bill for insurance. But I'll tell you, like, that is going to have its place, and that's fantastic, but it's also going to have its limitations. Just like you ask any doctor about the limitations of having to bill insurance, means I can't diagnose my patient the way I might think I can, because it's got to fit a CPT code. Right.
Yeah.
So there's a double-edged sword to all this stuff. So for folks listening, in terms of trying to find your place, think of, at the end of the day, what do you really want to, and sometimes it's both. There could be an opportunity for you to really make a difference within the medical system, working with a like-minded profession of some kind that views the outcome for patients, and if we can improve that, everybody's happier. Awesome. I want to be a part of it. And then you can, in many cases, still have your own deal on the side. Like, this medical practice just becomes a client of yours to a certain degree. Maybe you're running group programs and they're like, my mind is just buzzing about how health coaches, if the models first.
Oh yeah, the world's your oyster.
Absolutely.
It is. But there's just on that topic of trying to decide where you want to work and how you want to work. There's basically two choices to make. Do you want to work independently, working from home, 100% online, or even going into a practice that's in your locale to see patients face to face, but be independent and bill independently? You won't get health insurance.
Yeah.
If you don't have a job, if you're not hired with benefits, then you won't have those kinds of benefits. You'll have to fund those things yourself, but that's the price of independence. Right. But if you get hired to work in a hospital or an institution or a managed care organization, and HMO, they're going to have a lot of rules. You'll get benefits, but you might like to have a job. You might prefer to have a job with a salary. and somebody takes care of it, you get your paycheck, and that's, taxes are dealt with, and etc. So it's just a matter of seeing what's out there, and let it be aligned with you so that you do something that's where your heart is, because I think you're going to have options, tons of options.
I love that.
Yeah.
And so before we go, Michelle was asking, like, for if this is the direction someone wants to go, in terms of a path to be able to make this your specialty, what courses do we think people need, right? So I think if you really want to be able to make a difference in that medical system, I do think, personally speaking, that the national board will open doors for you that may not already be. So whether it's our program where you would take both the primary course and the master coach course, that's your educational ticket to then take the additional steps to sit for the national board. It takes work to sit for that. It's not just I graduate from an approved school and boom, I'm national board certified. It's not like that. There's additional steps. You have to pass their test. You need a coaching log. So gosh, coaches that are in our program or any other program, and you guys want to get out and just raise your hand to say, hey, I want to do a practice coaching session. As long as it's 20 minutes long and you're actually coaching and you're demonstrating competencies, that counts. Get there and take the master coach course, whether it's our course or another approved course, that's great. And then this is going to help you learn the language, learn how to speak, and have a greater understanding of what's coming down top down in the medical world that you need to be aware of if you want to approch these people. So in the industry. So
can I interrupt for just 1 minute on that, just on that track? Because I looked at the, I don't know what they called them. It was a curriculum for the national board certification. So I looked at their categories that they need. I don't know what you call it.
Job task analysis.
It's not competencies, but it was their.
It was the job task analysis. It was we had to build the curriculum around these.
Yeah, it's like there's an outline of their qualifications that they require, and it did overlap a bit with what we're doing here.
It does.
As a health coach, as a certified health coach, you will have some training in ethics and professional behavior and other things that sort of overlap with this, but this is very specific to the healthcare system. So it's fantastic to have, absolutely fantastic to have board certification. So you have your health coach certification, then board certification, and this is kind of gravy on the top. But you can go into the healthcare system and get a job with just this course, and then be working on your board certification on the side if you decide that you want to go farther or that you need to bill insurance or whatever it is.
Yeah. Yeah, I love it.
Is that clear?
It is.
Look,
it's a big topic.
All health coaches listening, not just Primal, but all health coaches listening. This is going to be one of the big areas of growth.
It's huge.
Putting a stake in the ground over the next 5 years. This is going to be where we see the biggest growth here. And gosh, do we need it? We need it. So, this is a fantastic time to go into health coaching, to be getting your reps in, get your coaching practice in, become a very good coach, really understand what it is that lights you up and who you want to serve and how you're going to help kind of solve this issue. And if you have a soft spot in your heart for helping patients, not just clients, but patients who are just left bewildered and overwhelmed, and they just need support. And to your point, if they've been in the system for a long time, a lot of that self-efficacy and sense of empowerment is no longer there. So helping that bid then. And that was sort of our goal with this course. So thank you for putting your expertise and your passion behind both this course, but also this conversation today. It really comes across, and anyone interested in finding out more about this course, it's just primalhealthcoach.com. Under programs, you're going to find it there. You can certainly just book a call with me or send an email. And then, so, Erin's typing in here. So to sit for the board, you need to take, if you're going to do it with our school, our primary cert, the Primal Health Coach Institute cert, and the Master Coach cert. Health coaching in a medical practice, to your point, is gravy. It's going to be what kind of helps you speak that language, I think, and go into from a standpoint of marketing confidence. Are there any other parting words, Erin or Judith, before we let people go?
My parting words are that Judith worked her tail off to make this a great course for health coaches, and just acknowledgement to you for doing all this work for us.
Thank you. It was fantastic. It was a fantastic learning experience for me, and a really good work to do.
Nice.
Yeah.
Awesome.
So everybody go out there and show them what health coaches can do, right?
That's right.
Yeah.
Awesome.
Thanks, Judy.
Okay. Thank you guys for having me.